developed this mild condition called cowpox. They might have only had 1 or 2 sores somewhere in their body, but the cowpox infection actually protected them against smallpox infection because they were in the same family, but the cowpox was much less virulent. So they started the process of what they call vaccination then. Vaca is a French word for cow, in case you didn't know. Right? Most people, I suppose, wouldn't. But they took pus from the cowpox sores and variolated people, like poked it into their skin. So they developed cowpox, and with the hope that it would prevent smallpox. I mean, the idea of sterility and stuff was early then. I'm sure they provoked cases of septicemia and other things like that, but this was early days in the process. Now, on first principles, I actually support the process of immunisation if that is to be interpreted to mean providing the body with antigens. Antigens are things that will elicit an immune response, especially a protective immune response. But what's gone wrong with our system at the moment is threefold. The first thing, in the older days, the doctors generally were far more honest. They were far more focused on what was good for the patient. I won't say universally, but it was obvious to me they were better people 30 years ago than they are now. Like the selection process where they stroke these little pricks' egos to make them feel like they're wonderful, they've done nothing more than swat hard and do well in HSC. That's all it is. It's easy to do well in an HSC if you know how to play exams. So you get the little smartasses that play exams well. You know, it's not hard and it doesn't make them better people, right? And massaging their egos is really a very dangerous recipe because there's nothing behind it. But that's another matter. But in the early immunisations, there was a genuine attempt to actually improve the health and well-being of people. It wasn't always achieved, but it was genuinely focused. And the sort of illnesses that they focused on in the first instance were the really ugly illnesses, the tetanuses, the diphtheria, the things like that, that were really ugly, damaging and killing sort of diseases that occurred in epidemics. But as in all of our society, there have been ugly forces at work which have hijacked the high ideals, of helping children to better health and helping society generally to better health. And now it's become a dog-eat-dog business where corporations, and they're not people anymore, they're corporations which have certain exemptions from sort of prosecution and things like that. And in the case of immunisations, they have managed to wheedle from their governments that they support by donations, basically immunity from protection. And that's the greatest problem. I feel that most of the problems with immunisation could be fixed by making the processes of immunisation a public health measure, removing the corporations and their profit motive and their disease mongering from the process, and just concentrate on those conditions where immunisation can be highly effective. Now the problem is, they say in the war on drugs, the first casualty is in truth. And there's certainly been a programmed war on health in this country and in the world generally. The pharmaceutical corporations have hijacked what it means to be healthy. What it means to be healthy is have your cholesterol controlled, and have your blood pressure controlled, have your blood sugar controlled, have your mood controlled, have your stabilisations. That's not health, really. That's just a slow subsidy before your death to the pharmaceutical corporations. Now, in the old days, when the Commonwealth Serum Laboratory was responsible for the manufacture of immunisations, certainly they weren't perfect. The process and the science was in a very early stage. But remember that the science of surgery was pretty ugly even 300 years ago. You were held down by burly men. If you were lucky, you had a quart of rum to drink and a piece of timber to bite on while they hacked off your leg with a hacksaw. Right? And now we have relatively pain-free and well-controlled anaesthetics and surgery. So medicine can evolve in a useful way, and I use a big distinction in my criticisms of the medical system between the different branches. I have very little to criticise amongst orthopaedics, for instance. people might know what orthopedics, the word, an orthopedic surgeon, was originally someone who straightened bent children out. Ortho means straight, pedics means children. So the orthopedics straighten people out with rickets and all sorts of things. It's a very noble undertaking, and very few people would complain about the practice of orthopedics now. I mean, it can always improve. It can be overtaken by preventative medicine, so Granny doesn't need a new hip or a new knee or something like that. These things are achievable if we follow proper lifestyles, but that's for another lifetime, I think. But there is a big distinction between surgeons, say, who are mostly doing good work and mostly focused on patient-centred outcomes, and this sort of army of physicians that really produce very little and are really the paid puppets of Big Pharma and really their dispensers and their drug pushers. Now, immunisations, if they were the panacea that people claim them to be, as we got more and more immunisations in the schedule, we should get healthier and healthier. But in fact, just the opposite has occurred. In the country with the most different immunisations in their schedule, the United States, their health outcomes are disastrous and deteriorating. Right? They've got a new category now for pervasive neurodevelopment delay, and it's now affecting 1 in 6 children in their country. Right? Pervasive neurodevelopment delay is another word for brain damage. And whether it occurs through an encephalitic process or a hyponutrition process or a combination of all the above. But now they're happy to report that 1 in 6 of their children have some form of significant learning disability. That is an atrocious statistic to know, but it's an atrocious statistic to do nothing about, especially because of the kinetics of how it's increased. Now, when it all comes down to it, what does the system do? They blame the genes. Why is this kid autistic, or this kid autistic, or why has this got Tourette's? Oh, it's their genes. I said, it's funny, it wasn't their parents' genes. Why is it their genes? Right? There is no way in the world a genetic condition can dramatically increase within a generation. Right? You have to introduce a gene to the gene pool and have it sort of dispersed within the gene pool, but you can't have a doubling or a tripling or a quadrupling of the incidence of a disease if it's genetics in one generation, right? It just beggars credibility. Now, for a long time, I suppose, in my youth, or my academic youth, in my 20s and 30s, there wasn't really much of an issue with immunisation. I mean, I've given plenty of immunisations and things like that, but I have an unfailing recollection of being in a neurology tutorial in the 1970s, and a very wise old professor, they used to be wise old professors now instead of little dancing clowns, it's a bit sad, but I haven't found a wise old professor in the last 15 years, I think they've all died off. But I had the fortune of speaking to this fellow, and he showed me a 3-year-old child, and quite openly he said, this child is damaged by the pertussis immunisation. This is back in the mid-70s. And he said, we record a rate of about 1 per million at the moment. So they were quite open about it. And at that stage, I don't know how many people are up to date on the minutiae of it, but the pertussis, or the whooping cough immunisation, has been responsible for more adverse outcomes with regard to immunisation than all the rest of them combined until the advent of influenza and HPV. But that's changed now. But in the old days, they used what they called a cellular pertussis immunisation. It was basically just these dirty gram-negative germs ground up and injected with variable amounts of endotoxin and other unknown inclusions. And every now and then they claimed it was 1 in a million. So that's, you know, like a dozen kids sort of overall, a bit less. It just depends on how it went. But it was easily accepted, and his view was that they're moving towards an acellular immunisation. So there was a transition from a more dangerous to a less dangerous so-called form, but it was handled in an honest way. Now that level of honesty has now gone out the door. I say to people this, when have you come across any pharma drug that doesn't have a side effect? Right? How many people have read the insert packages from any drug? The list of side effects is enormous on everything. And it usually includes a range of reactions from very severe up to and including death, all the way down to blistering skin reactions and organ toxicity. The drugs are inherently prone to side effects. Why should immunisation be any different? Right? The answer is, it is not. It's just a simple fact that anything that you give can have a side effect. The reason why I personally have gravitated towards concentrating on dietary medicine and cannabis medicine, because it's one of the few things that actually adhere to the precept of Hippocratic medicine of primum non nocere, that's first do no harm, right? Even something like penicillin, which is an excellent drug when you need it, if you've got a pneumonia or something like that, can have reactions. It can have lethal reactions. It can kill about 1 in 100,000 people with an anaphylaxis. Now, we don't stop using the penicillin, but we recognise it. We record the number of adverse outcomes, and we make, or you're meant to make, a considered judgment for risk versus benefit. And you should only use something when the risk is greater, sorry, the benefit is greater than the risk you might incur. Otherwise, we're going backwards. The problem, there's a song by Bruce Cockburn, I don't know if anyone knows this, there's a trouble with normal is it always gets worse. And that's exactly what's happening here. The trouble with normal is it always gets worse, right? They're increasing the schedule. Despite the experience of the United States, when you bombard a child with too much antigens too soon, right, you start to have adverse effects. So instead of actually increasing not only immunity, but health outcomes, right, there's no point in getting a reaction. I'll just talk to you briefly about the types of reactions you get. If you would have come to one of my Mardi Gras talks about 2 or 3 years ago, I showed in the hall there, I showed a insert from the influenza immunisation, which states in large letters right down the bottom of the insert, no studies have been done which demonstrate that this product results in a lower incidence or severity of influenza, right? And this is the one that they're talking about mandating. Now, equally with immunisation, I say without a shadow of contradiction, no safety studies have been done. If there is, I've missed them, and someone should really show them to me. What would involve in a safety study? Let's say we wanted to say that the immunisation schedule to say 5 years may result in an increased risk of, say, autism or some other neurodevelopmental delay of some form as yet uncharacterised. How would you actually prove that? For a start, you'd need to get a group and a control group and compare them longitudinally, right? It's not a hard study to do. 5,000 kids would probably be enough to make it statistically valid. 10,000 would be a lot better. So what we want is 10,000 immunised kids and 10,000 unimmunised kids. And let's compare them. That would sort it out in 5 years without a shadow of doubt. And it won't be hard to find the control group. I mean, we could find 10,000 mothers that didn't want their kids immunised in a weekend on Facebook, I'm sure. So what we're after, what we want is a control study, right? But before that, I would prefer that there was a really hard look about what's in the schedule and why it's in the schedule. Now let's start on day of birth. Canakion, or vitamin K, in my impression, it has been given for valid reasons to reduce the incidence and severity of hemorrhagic disease of the newborn. But without going into all the science of it, if the injection is not given as an injection, but given orally, you get the same degree of protection and firstly, no pain on a newborn. You've all seen newborn babies, right? They're not fucking junkies. They don't need needles, right? They need love and breast and things like that, right? They don't need the pain of a needle. I've seen these psychopaths doing circumcisions on kids at day 2, and they don't feel pain. I say, you might not, mate, because you're stupid, but that kid's feeling pain, I can see it, right? And feeling bad pain, traumatising pain. The needle is a small thing there. If you give 3 oral doses, you get the same degree of protection and no risk of a side effect, no risk of sensitising to incipients like peanut oil and things like that. That's an easy fix. Why don't we do it? That's the big question. Why don't parents have the choice? Right? I mean, almost before the placenta's out, you know, some bastard is jabbing the little baby with a needle, right? I simply feel it's not necessary. You're cracking a walnut with a sledgehammer, whereas it could be broken with some much smaller instrument. That would be oral vitamin K. So as you can see, I'm not against interventions, but they have to be well sorted out and strongly risk versus benefit positive. What do they do next? Hep B. Now we happen to have an extraordinarily low carrier rate for Hep B. If we were living in rural China and there was a 10% positive maternal Hep B rate, right, there would be a strong argument in favour of giving neonatal hepatitis. But in this country, where the carrier rate in the average demographic is minuscule, there is not a single rationale for giving day one hepatitis B, as far as I'm concerned. The use of it on day one is compounded by the fact that its effect wanes in about 12 years. Just when the kid is starting to think about getting sexually active and maybe jabbing a needle here or there and putting themselves at risk, their immunity wanes to nothing. There is not a scintilla of credible evidence to give non-high risk people a hepatitis B injection at birth, right? It should be given on request for teenage years. That's my opinion there. So again, it's unnecessary. The film that you're about to see with Wakefield, I mean, I haven't gone over the statistics and the data with a fine-tooth comb, and unfortunately, facts often don't sway arguments in this country. It's really the loudest voice or the person that gets their mush on the Daily Telegraph or the 6:30 report or something like that. It's a country where intelligence is no longer regarded highly, rather the volume and the constant repetition of a message is what's sort of relied on as truth. It's a long way from that. Now, the triple antigen, they give the tetanus, the diphtheria and the pertussis, and now a few others sort of here and there at 2, 4 and 6 months. You just have to go to a school that deals with neurodevelopmentally delayed kids and ask a dozen mothers, what happened to this child? Oh, he was going fine until, right? There is no doubt that there is a temporal association between some immunisations and a precipitous regression in a child which at this stage hasn't received an adequate explanation, at least in official circles. Now, my interpretation is that you can't say something causes something by itself, right? Medicine's full of strange paradoxes. For instance, something like 5% of people might carry meningococcus in their pharynx, but only about 1 in 5,000 or less develops invasive disease. There's a difference between the virulence of an organism and the defence of the person. Now, a lot of what my immunisation education came about, or at least one facet of that, was the work of Andrew Katelaris. He was a doctor that was working at Collarenebri in the 60s. Now, when he went out to Collarenebri in Western New South Wales in the 60s, he found, to the disgrace of this nation, that the infant mortality rate in Australia was 50% in that community. Half the children died before their 12-month their first birthday. 50% infant mortality. Bangladesh didn't have a 50% mortality rate, so it's an eternal disgrace on this country. Now, what he did, he was a young and enthusiastic, conventionally trained doctor, so he increased the immunisation rate amongst the kids, and to his horror, he saw the death rate go up. Right? Now, he was really quite perplexed. He didn't know what to do, because he was hoping he'd be saving a few lives. Luckily, he spoke to a very knowledgeable consultant physician, of which there's very few left alive, and he said, look, these kids are probably going into shock as a result of an excess antigen challenge. Now, to put that in simple terms, if you challenge someone with an antigen, something that's potentially toxic, they use up their antioxidants dealing with it, the primary antioxidant being vitamin C. If you're compromised with your vitamin C and zinc levels and your glutathione might be operating at top level, you can have a reaction to something that another person could detox. So just let me tell you what has informed my view on this. So then Archie went back to his community and supplemented all the kids with vitamin C and zinc and a whole lot of other things, made sure they were well tanked up on all essential stress-fighting nutrients, and then he went on to immunise them all. And at the end of 2 years, he got the death rate down to 0, right, with full immunisation. So that taught me something, that there is an interaction between the child, like the ones that get shot. It's more complex than that, because I think there's a lack of quality control, and at least in some of the pertussis ones, we were dealing with an endotoxin overdose because of poor quality control. So no argument is really simple. But what it did demonstrate to me over a period of years, that you could in some ways immunise safely, that in some immunisation reactions, it's a result of an acute oxidative stress on the system, perhaps a breaching of the blood-brain barrier and a form of chemical or viral encephalitis. Now, that mechanism is probably very much at play in the measles, mumps, rubella. And now I've just been reminded by one of the ladies over there, they weren't satisfied with measles, mumps, rubella, but now they've added varicella. So at the age of 12 months, the child's exposed to 4 live viruses. Now remember, one of the side effects of measles can be an ordinary childhood illness that everyone suffers from. I mean, the whole family has it and then everyone gets better. But about 1 in 2,000 or something, 3, 4, whatever the population is, develops this hideous thing called subacute sclerosing panencephalitis. And my impression is, when they give a live virus, they call it a live attenuated virus. Right? By that I mean you get an ordinary measles virus and you passage it through different media so it loses some of its toxicity. Then it becomes an attenuated virus, and you give the person the virus, right, and it multiplies in their body, provokes an immune reaction, and theoretically gives them lifelong immunity. That's the idea. Although this idea of lifelong immunity seems to be fading very rapidly, because there's a big difference between antibody-related immunity and cell-related immunity. So depending on how the antigen is presented to the body, it will either have a great reaction with a memory. So if you've got... You want me to shut up?
So I just got out of thing.
Eh? All right. All right, so you want to show the movie now? All right.
Yeah, I'm just realizing, don't shoot the messenger bird.
Yeah, I'm enjoying it.
Well,
I don't know, I mean, I'm just like, there was some debate.
5 minutes, 5
there was
minutes.
some debate.
5 more minutes, okay.
I'll carry on and then...
I'll just come down to it, because I'm not against the idea of immunisation. What I'm against is the practice, right? It's not a cash cow for greedy corporations to screw little kids, that's number one. It's not something that you can just keep adding more and more and more to without a demonstration. The only demonstration they're doing is if it produces a few antibodies. They say, we've got an antibody response. We can charge you hundreds of dollars now, right? I'll finish on this. There are great ways to do immunisation and there are really poor ways to do it. And in every instance, we've chosen the poor way. I'll just give you one example, and I know there's a bit of time pressure now. The influenza virus has 2 components. You have what you call a core, the core antigens, right? And then arrayed around that are the surface antigens. Now, a group of really dedicated scientists at Walter and Eliza Hall developed an immunisation to the core antigens, the ones that don't change from year to year, by delivering it up people's noses. Because if you have a immunisation that's delivered by an appropriate route, you're more likely to get what we call mucosal immunity. That's this thing called IgA operating locally, and then an IgG response. So you get a double whammy. You get a quick response and a delayed response when it's presented properly. When you present it through the skin, you don't get anything like that, because that's not the way the body is used to receiving these. Anyway, long story short, these scientists at Walter and Eliza developed an immunisation to the core antigen that you snuffed up your nose, no needles or anything like that, and it seemed to give really solid protection for 7 years. And these other pricks from their corporations developed immunisation to the surface antigens, which are rearranged every year and change from year to year, right? So they may give you anything from no protection at all to a little bit of transient protection and a whole lot of problems. Most people, I'm really against the flu immunisation. Which one got ahead? The surface antigen one, the one they have to change every year, the one that doesn't actually work, the one that says on the product insert, this has never been shown to work, but suck it up anyway, now it's compulsory. Right? This is a serious business. We can do immunisation better. The idea, and I'll finish on this point, of the triple, the measles, mumps, rubella, there appears to be data that indicates not only is it safer to give the immunisations separately, but you get much better immune reaction. Think about it. You get 4 infections at once, your body is pushing it uphill to make a response to all of them. Space them out by 4 weeks or 6 weeks. None of those diseases are so prevalent that they need that. We're not in an epidemic situation. Now, I'll close on this, Sister. I'm sorry. I'll close on this point, and that is the issue of herd immunity. Like the squealing weasels from the Telegraph and Channel 9 and things like that say these people that don't want to immunise their children, want to protect their health by superior nutrition, saturating them in vitamin C, make sure their zinc levels are high, all these sorts of things. And let me say, I mean, vitamin C is an excellent antiviral and antibacterial. It's every bit as good as bloody amoxil without upsetting your system, and nowhere near as much. But, well, hang on, what was I going to finish on? Gee, I've just lost it there. Just let me think. Hey? Yeah, the herd immunity, of course, and that's an important point. They say that the unimmunised kids are putting their kids at risk, right? There's very clear evidence that in the outbreaks that we have, and they're relatively small outbreaks, but in the outbreaks we have, it's mostly immunised kids with failed immunisation. Like, for instance, I've had full immunisation against whooping cough, but I got whooping cough looking after whooping cough patients. Admittedly, it wasn't a very severe disease, but they're not very good, right? And the ones that cause the most side effects are the ones that are least effective, like the influenza. When it was first brought out and mandated as compulsory in 1974 by Richard Nixon, he did some backhanded with his farmer mates and said, we're going to do all the federal employees. They did 300,000 of them. 30,000 got Guillain-Barré paralysis, and that put an end to it. But it didn't stop them. 40 years later, they're doing it again. Right? That's the problem with this system. It never gives up. There's an old saying rust never sleeps. That's what they're like. They're a corrosive influence that are constantly working. Now, when you engage in argument, be rational, be intelligent, look to the high point. What we're against, we're not against, in principle, immunisation, but we're very much against compulsory immunisation of an untested product, and we simply want to be assured that the risk-benefit ratio is in favour of putting our kids at risk. And I don't think that's too much to ask.
You want to get rid of that?